Okay, guys, welcome back. And now we are on the respiratory system. So let's get started with the respiratory system. Here's kind of an overview of your respiratory system. As you can see, this is the upper respiratory tract, and this is the lower respiratory tract. The nasal cavity, nasopharynx, oropharynx, laryngopharynx. These three make up the pharynx. And then the larynx, and that's your trachea. And then left and right primary bronchi, down to bronchioles. And we're going to break this down for you step by step so that you completely understand it before this is over. All right, so the respiratory system is basically responsible for the exchange of gas, particularly getting in oxygen, letting go of carbon dioxide between your external environment and your cells. And it needs help from the cardiovascular system. And what does it do? It ventilates, exchanges gas, and transports oxygen and carbon dioxide. And, it also controls your lungs, control your acid-base balance. If it weren't for your breath, you wouldn't be able to speak. And the respiratory system, like I said, depends on your cardiovascular system, circulatory system, and also your nervous system, because your nervous system has to innervate the muscles that make your lungs expand and contract. And in order for you to breathe, you don't have to think about it. And that's because the respiratory center at the base of your brain and the medulla oblongata is there to make your body breathe in and out, right? Okay, so here's another overview of the respiratory system, just a little bit different than the first one. And if you look here, you can see the airway, right, is here, and the esophagus is directly behind it. Make note of that. So the esophagus leads to the stomach, but here the larynx, vocal cords, this and the trachea goes to the lungs. Okay, the epiglottis is this little kind of flap that flaps over and covers up the airway so that when you swallow food or drink fluids, they go into the esophagus and not into the airway. If you've ever had anything go down the wrong pipe and you've choked, the epiglottis didn't shut when it was supposed to for whatever reason, and that's why you choked. Okay, so let's look at the upper respiratory tract. So here's a side view. If you look into someone's mouth, here's the oral cavity or the buccal cavity, the mandible, which is the jawbone, right? This is your nose. The openings to your nose are called nares, and they lead into the nasal cavity. But if you look here, you can see they're all connected, right? So this is the palate, the hard palate, right there. And then back here, you've got your uvula, a little punching bag, okay? And your palatine tonsils are back there. They're actually on either side. And they lead to the oropharynx, the laryngopharynx, and then into the larynx. And in the larynx, you've got your thyroid cartilage, your vocal cords, and your thyroid gland. There's your thyroid gland. That's the one that you can palpate. That lead to the trachea. And remember, trachea is in front, esophagus is behind. Okay? So when you breathe, air enters and leaves through your nose. And just inside your nose, there are little hairs called cilia. And they're there for a reason, first line defense. They filter out dust and foreign particles so they don't get into your lungs. And the nasal cavity is separated from the mouth by this thing called the palate, right? Bony structure. Then there's a vertical plate of bone and cartilage called the septum, separates your nasal cavity into two halves. And that cavity is lined with epithelium rich in goblet cells that produce mucus. You ever had a kid with a snotty nose? You know what that's about. Projecting from the lateral wall of each cavity are three bones. They're called conchi, and they warm and moisten the air as it flows past. Any dust or foreign objects stick to the mucus that's there. So the mucus is there for a reason. You swallow the mucus, it goes down into your stomach, and that hydrochloric acid in your stomach just destroys it. So it doesn't go into your lungs. Branches of the olfactory nerve go through the upper nasal cavity and go right to the brain. That's how you can smell. And the sphenoid sinus and the other paranasal sinuses, there's lots of sinuses. The frontal, maxillary, and ethmoid, they all drain into the nasal cavity. Okay. There are your frontal sinuses. Okay. Sphenoid sinuses are back there. That's the olfactory nerve that we just spoke of that goes to the brain. There's your hard palate. And all the way in the back is the soft palate. And there are those three bones that I spoke of, the conchi, that kind of warm that air up when you breathe in. Okay. And remove any kind of foreign objects or dust. Okay. Just behind the nasal and oral cavities, there's a tube called the pharynx. It's not the pharynx, it's the pharynx. Pet peeve, common mispronunciation. So it's called the throat. The pharynx is your throat, and it's got three areas, three regions. The nasopharynx is right behind the soft palate, and it has openings for the right and left eustachian tubes for your ears. See, everything here is interconnected. Then the oropharynx is the space between the soft palate and the base of the tongue. That's where the tonsils are. They're the ones that are removed if you have a tonsillectomy. And then there are lingual tonsils at the base of your tongue all the way in the back. Then you have the laryngopharynx, which passes dorsal to the larynx and connects to the esophagus. Only air passes through the nasopharynx, but both food and air pass through the oropharynx and laryngopharynx. But that's why that epiglottis is there, to protect the airway from food and drink going into it. Okay. And there's a good picture of it, as you can see. So nasopharynx here goes down to the oropharynx. So this is only air. Here you eat, food, drink, and air go in here. The laryngopharynx is where either just air goes in to the trachea, or if it's food or drink, it goes into the esophagus back here. Okay. So the larynx prevents food from and liquids from entering your trachea, kind of acts like a passageway, and it's producing sound. That's how we speak, right? The larynx has 9 pieces of cartilage that kind of keep it together, keep it from collapsing. And then there are ligaments that hold them together. The epiglottis is that little flappy thing that will close over top of the larynx when you swallow. So food and liquids go into the esophagus, right? And then the largest piece of cartilage is the thyroid cartilage, which on men, it's usually prominent, and we call it an Adam's apple. Then the mucous membrane lining the larynx forms 2 folds. Don't worry about knowing this, but vestibular folds close the glottis during swallowing. They have nothing to do with being able to speak. But the vocal cords, they are part of the glottis. Then the opening between the cords is called the glottis. And that's how we make sounds, from high-pitched sounds to low-pitched sounds. It requires air passing through those vocal cords in order for the sounds to be made. So here we go. You can kind of see it again. Side view. There's your nasal cavity. This is your tongue. Yeah, it's pretty big, believe it or not. This bone right here is the hyoid bone. There's your epiglottis, and this is your trachea. Okay. Your esophagus is behind. This is the glottis right here. Okay. Okay. So the nose, like I said, know that there are cilia or hair that help prevent, that's first line defense, it's like filters, preventing things from going in to the lungs. And then you have those sinuses. You don't need to know all of them, but you should at least know, maxillary, frontal. The others are in the back, ethmoidal and sphenoidal. And then the pharynx, that's where the air travels through, and food and drink all go through the pharynx. Okay. Make sure you understand that. The nasopharynx, that's where behind the nose and connects to the ears, the eustachian tubes. Your adenoids are there too, which are your pharyngeal tonsils. Then you have your oropharynx, which is behind your mouth, base of your tongue, 2 palatine tonsils, 2 lingual tonsils. And then you have your laryngopharynx, and that's where your larynx and your esophagus are. And one is for food and drink, and one is for air. And never the two shall meet. So your larynx is also called your voice box, and that's where the actual vocal cords are down there. Air passes through, and then there's the epiglottis. Make sure you understand what the epiglottis is. It's just a little, like a lid of cartilage that guards the larynx so that food and drink don't go into the lungs. Okay. And then your vocal cords are also cartilage, and they move kind of like cords to produce sound so you can speak. Okay. So excess sinus secretions are often present in a head cold. It's true. If you said true, you'd be right. The sinuses drain into the nasal cavities, which drain into the throat. So because they're all connected, it's easy to get, if you have a cold, to get an infection, and they can spread quickly to one another. And by the way, that drainage is called rhinorrhea, a runny nose, rhinorrhea. I'm going to add that in here so you know the word. Rhinorrhea is a runny nose. Okay, then we have the lower respiratory tract, and that's just the trachea, the bronchi, and the lungs, the lower respiratory tract. There's a picture of that. There's your thyroid cartilage, cricoid cartilage. Here's your trachea, goes down here, and that's where it divides to the right and left, right? Bronchi, which go into little bronchioles. And at the base of the bronchioles, there are alveoli, and we'll get into that in a minute. Okay, so your trachea is your windpipe. That's another name for that. So air passes into the trachea, and kind of like horseshoe rings, right? Keep it open all the time. The bronchi is when the trachea divides into two, and each bronchus is divided into tracheobronchial trees, and the bronchioles branch into alveolar ducts and alveolar sacs. And the walls of these alveoli, they kind of look like clusters of grapes, but that's where gas exchange actually takes place. So the alveoli have something in them. They're lined with something called surfactant, and you should know that. It's almost like a lubricant, but it's needed in order for that exchange of carbon dioxide and oxygen, because the alveoli take in oxygen, put out carbon dioxide. Okay. All right, so here's another view of this. There's your trachea, right? And there's the left and the right primary bronchus. It's important to take note when you look at the structure here. Do you see how the left is a little more to the side, whereas the right is kind of more straight down? If you're going to aspirate, in other words, if you're going to have a piece of food or drink go down the wrong pipe and, accidentally go into the trachea instead of going into the esophagus, more likely for something to get lodged in the right bronchi as opposed to the left, just because of its design structurally. So do you see how it'd be easy for something to go and go right down into the right? It's important to remember. Okay. All right. So what are the lungs? There are two kind of balloons in a balloon, I call them. Okay. They're two cone-shaped lungs. They fill up your chest cavity. The top, which is the apex of each lung, is right above the first rib, and the base rests on the diaphragm, which is a big muscle that goes across, like underneath your lungs. Remember, the right lung is shorter and wider and larger than the left, and it has 3 lobes, handles 55% of your gas exchange. The left lung only has 2 lobes. Please remember that. Right lung, 3 lobes, shorter, broader. Left lung, 2 lobes. And then you have the pleura. The pleura is kind of like a sac, a membranous sac that is around each of the lungs. And it lets the lungs move in and out, because breathe in, breathe out. Okay, and we're going to talk more about the pleura in a bit. But here is kind of the way things go down the respiratory tract. So the trachea is in front of your esophagus. It's a very stiff, rigid tube. It's about 4.5 inches long. The cartilage are C-shaped rings. They encircle it and keep it from collapsing so you can breathe. And the open part of the C faces backward, so your esophagus has room for you to swallow food, right? And then at the carina, which is when the trachea branches into the lungs, it has 2 ways to go, 2 primary bronchi, also supported by those C-shaped cartilages. And they go to each lung, and then they divide into smaller branches and smaller branches. You don't need to know the secondary, tertiary, but they branch out smaller, smaller, smaller until they are bronchioles. Okay, bronchioles are divided up even more into things called alveolar ducts. And the alveolar ducts throughout the lungs terminate in these clusters of alveoli that are called sacs, alveolar sacs. And again, very important to remember that at the alveolar sacs, that's where the gas exchange takes place. Okay. So here we are kind of looking at a front view, and you see how the heart is in the middle of the chest in the mediastinum, and it kind of tilts, to the left a little bit. So you see, when you look at the chest this way, kind of makes sense that there are only 2 lobes here and 3 lobes on the right, 2 on the left, 3 on the right, because the heart kind of takes up some space here. And then this is your diaphragm, right? This big old muscle that goes across, okay? And there's your vena cava, the inferior vena cava, and this is your descending aorta. Here's your ascending aorta with its branches, and this is your superior vena cava. And it's gonna start to make sense about the cardiovascular along with respiratory. Now, if we cut you in half this way, and we were looking from above, this is kind of what it would look like, okay? So this is the anterior, this is the posterior. And if we were looking down, like this is your sternum, here are your ribs, okay? There's your left lung, right lung. Your heart is in the middle, okay? Here's your trachea that divides into the bronchi, which divides into the bronchioles. This is your esophagus, right? It's right behind. And these are your vertebrae in your spine. And this would be your spinal column. And in the middle would be your spinal cord. Okay. So the pleura, again, covers the surface of the lungs. That's the visceral pleura. Then the parietal pleura, and we can go back to the picture. So the visceral pleura is actually around the lungs. That's in blue. Okay. The parietal pleura is the green. You can see the green there. And in between the visceral and parietal pleura, there's a space, and that's called the pleural cavity. It's just a little bit of space so that there's room for the lungs to expand and contract. And in that space, there's a little bit of fluid, like a lubricant, that allows the lungs to expand and contract without rubbing, no friction. Okay, so that's the pleural cavity, the visceral and parietal pleura. Okay. We talked about the lubrication, lets them, glide together so that there's no friction. Okay, here's a question. Inhaled food or foreign objects are most likely to lodge in which part of the respiratory system? Remember, we talked about this before. Anybody remember what it is? If you said the right bronchus, that's the one. It's wider and it's more vertical. So it's the most likely location. If you're going to choke on something, that's probably where it's going to get stuck, the right bronchus. Okay. Now, when we look at the respiratory system, this is the section of, remember those clusters I talked about of alveolar sacs? This is what these guys are. And when you look here, okay, pulmonary artery, right, from the heart, the deoxygenated blood goes from the right ventricle through the pulmonary artery to the lungs, goes to these alveolar sacs and drops off CO2 and picks up oxygen and then goes back through the pulmonary vein to the left atrium. Starting to make some sense now? A little bit. This is where all the gas exchange takes place in these little clusters. Okay, and here's an even better picture. This is basically what they look like. They look like clusters of grapes. So the alveoli are wrapped up in these tiny, tiny little capillaries, right? See all these little capillaries? And inside of each of the alveolus it's coated with this fluid called surfactant. Surfactant is, like I said, it's like a lubricant, and it reduces tension and it keeps the alveolus from collapsing as that exchange of carbon dioxide and oxygen takes place. So the heart, the right side of the heart, pumps that deoxygenated blood to the lungs to go here to get rid of carbon, pick up oxygen, and then go through the pulmonary veins back up to the heart and then go to the body. Okay. Starting to make sense, I think. Starting to make sense. Okay. So now, when we talk about respiration, two kind of different things going on. We have internal respiration. That means it's at a cellular level. So when that left ventricle is pumping that oxygenated blood, it's bringing oxygen to your cells and it's exchanging oxygen for carbon dioxide, right? So that's the cellular respiration. But then your pulmonary respiration is when that blood goes back into the lungs, carrying CO2, drops it off, and picks up oxygen, goes back to the left side of the heart. Okay. So as far as the physiology is concerned, the lungs are responsible for ventilation. That's the movement. External and internal respiration. That's that gas exchange, oxygen and CO2. The lungs also manage acid-base balance because CO2 is an acid. Then there are some respiratory reflexes, coughing, sneezing, right? Things like that, yawning, hiccuping. We'll get to those later. And then being able to speak, vocalization. La. Okay, so ventilation is the act of breathing. It's the mechanical process, right? Moving air in and out. You have inhalation, also called inspiration, which is breathing in. And then you have exhalation or expiration, breathing out. Okay. So now, how does it work? How does the mechanical part of it work? Well, muscles. Okay. You have that diaphragm, dome-shaped muscle that separates the thoracic and abdominal cavity. And then you have intercostal muscles. They're in between the ribs and they contract to lift and spread the ribs when you breathe in, adding to this vacuum kind of thing. Get air in and then let air out. Okay. So here are the reflexes. What is a cough? Coughing is a mechanical reflex that protects us because there are sensory receptors inside the bronchi and the trachea that if you get something caught in there, you'll cough. And that is your body trying to expel whatever got stuck. Sneezing. You sneeze for a reason. So it dislodges materials out of the respiratory tract when there's something going on up in here in the nasopharynx, most likely. Yawning. So the book says yawning is a response to a lack of oxygen or an accumulation of carbon dioxide. But I knew that that wasn't exactly accurate. So I did a literature research and I found this article on the National Institute of Health's website, which is the government's medical library. And this article, if you want to look at it, this is the hyperlink. It has been disproven that yawning is caused by low O2 or high CO2. Okay. See, this article above was funded by the writers of this book, Walters Kluwer. Right. And there were 37 references from peer-reviewed medical journals. Why do we yawn? Lots of reasons, but not because of oxygen or CO2 levels. You can yawn because you're bored. Yawning cools off your brain. So yawning does a lot of things. You won't be tested on this because, it's a little more complex. But, just so you know that when you come across something and you think to yourself, is that really true? This is the way you find out if something is accurate or not by looking it up and going to peer-reviewed journal articles that are credible sources, right? You don't just Google it. Google's just a library. Don't just Google it. Okay, now let's talk about the muscles that we use to breathe. Now remember, the muscles have to get stimulated by your nervous system, by your brain. And the main muscle is your diaphragm. That's diaphragm contracts, flattens, and drops right up and down. You have external intercostal muscles and internal intercostal muscles. The externals pull the ribs up and out, which makes your thoracic cavity get wide. The internal intercostals elevate the ribs, and the diaphragm contracts and flattens and drops, pressing your stomach and your abdominal organs down, making the thoracic cavity bigger so you can get in air. When you exhale, expiration, the internal intercostals relax, the diaphragm relax and pushes kind of forward and reduces the size of the thorax or the thoracic cavity, and the air is pushed out. Okay. For people with like COPD or any kind of chronic or even acute breathing problems, when labored breathing occurs, where somebody's struggling to breathe, okay, when that happens, there are accessory muscles that are used. So people with COPD, you will see that they try to take a deep breath. And when they do, they'll lift their shoulders, elevate their chest, right? Those are use of accessory muscle telltale signs. So the sternocleidomastoids and the scalenes, you should know these two. The sternocleidomastoids and scalenes. They are the two sets of accessory muscles that you will typically see used when someone's having difficulty breathing. Okay, so somebody like with COPD or any other kind of breathing issues, they're using their body to breathe instead of just, right? And then sometimes in order to get the air out, the rectus abdominis, and you don't need to know this, but just think about it. They'll use their belly to get the air out, to try to force it out. You only see the use of these accessory muscles with labored breathing. So that's how you can kind of look at somebody and say, ooh, they're having trouble breathing. All right. And here's a good picture of those muscles. Okay. So the ones that are always in use, your diaphragm, right? The external intercostals and then the internal intercostals. The up, ooh, make it wide, ooh, make it contract. Okay. When we look at the sternocleidomastoid and the scalenes, which are way up here, right, by the shoulder, by the neck, doing that, those are use of accessory muscle telltale signs. Okay, here's some words you need to know. Dyspnea, that means trouble breathing, difficulty breathing. Orthopnea, you can't breathe when you're lying flat. In other words, it's dyspnea that's relieved when you sit up. Eupnea means you're breathing normally. Bradypnea, slow respiration. Tachypnea, rapid respiration. And a normal, within normal range respiratory rate is 12 to 20 breaths per minute. So I'm going to put that right here. 12 to 20 breaths per minute. And that's for adults. It's different for infants and it's different for children. Okay, so that's for adults. Okay. Okay. So ventilation, we already talked about those muscles go into play. The chest cavity gets bigger, creates kind of a vacuum and air goes in. And then when you expire, everything relaxes, air rushes out. Okay. Sounds pretty simple, right? Okay. And when we talk about the air rushing in and out, you know, it has to do with a pressure gradient. You don't really need to understand this, but I'm going to explain it anyway. When you inhale and the diaphragm starts to contract and move down and the chest cavity gets big and the lungs expand, then there's more pressure inside than outside or outside than inside. Then when you exhale, there's more pressure outside than inside. You can see the arrows, right? It's all about a pressure gradient. You don't really need to understand that, but just know that the trigger for inspiration and expiration comes from the brain's control center, the medulla oblongata, and that's what innervates those muscles to make those actions happen so that you breathe. And you don't have to think about it. It's part of the autonomic nervous system. And there you go. So that's expiration and higher pressure. You need higher pressure inside to breathe out. Believe it or not, it doesn't sound like it makes sense. You would think there's more pressure when you breathe in, but no, When you breathe in, to breathe out gets rid of that pressure. Okay. Here's a side view of ventilation, kind of showing how the diaphragm moves up and moves down. So when you breathe in, the diaphragm goes down, excuse me, to let that cavity get wide and to open up the chest. When you breathe out, the diaphragm moves up and, kind of squeezes the air out. Okay. Is the following statement true or false? A puncture wound or other opening into the chest must be immediately plugged. Think about it. Because of that pressure gradient that goes on, if you got stabbed in the chest, right, that would be very bad. So, the wound would have to be plugged up or closed, or your lung would collapse. And when we get to med surg, we'll talk about, collapsed lungs, pneumothorax, atelectasis, and all those things. But if somebody were to get a puncture wound or any kind of opening into the chest, it's got to be sealed to maintain the pressure gradient, or the lung will collapse and you wouldn't be able to breathe. And that would be bad. Okay. So now when we talk about the brain controlling the breathing, you have the inspiratory center, which is the primary respiratory center of the brain. Okay. The medulla and the pons, the medulla oblongata and the pons. And you have the apneustic center that can increase the length and depth of inspiration. In certain instances, say you're exercising or you're running, you need more air. It'll make you breathe deeper involuntarily. Okay. The pneumotaxic center in the brain prevents you from breathing too deeply so that you don't overinflate your lungs, right? So that there's no damage. And then the expiratory center, that's used for forceful exhalations. So in other words, if you want to blow out candles, right? So that's the nervous system and how it controls all the muscles to allow the lungs to do their thing. It's amazing, right? It just gets more amazing. And this is an overview of basically what I just said. When we talk about things like singing, breathing, eating, talking even, the cerebral cortex gives you some voluntary control. Okay. Most of it's involuntary because you don't think about breathing. So the medulla oblongata is just controlling how the rate of your respirations and the depth of your respirations. And then the pons has these other centers that I talked about that work together with the medulla to keep it in a normal rhythm. But if you want to la 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 la, or you're talking, or you're trying to eat because you can't really eat and breathe at the same time, your cerebral cortex allows you to take over some control and change that rate of breathing when you need to. But most of the time, it's on automatic pilot. It's amazing. All right. Lung volume and capacity. How much air can you hold, right? And it's different for different people. How big are you? How small are you? What kind of physical condition are you? How old are you? Even gender, there's differences. And diseases, any pulmonary diseases, or anything that limits the chest cavity from expanding and contracting can cause pulmonary issues, right? And the ability of the lungs and the thoracic cavity to expand influences how well you can breathe. So think about diseases like Parkinson's disease with muscular rigidity. And when that happens, they can't expand their lungs. And they can't breathe very well. So that's what that's about. We talked about the difference between pulmonary respiration and tissue respiration. And remember, oxygen and carbon dioxide are transported by the hemoglobin in your blood, right? Coming from the heart. When we talk about that in the lungs, the gas exchange at the alveoli, that's where the hemoglobin is going through those capillaries to the alveoli, dropping off carbon dioxide so you can breathe it out, picking up oxygen, and then going back to the left side of the heart to get pumped to the body. The carbon dioxide we breathe out, but some of it gets dissolved in our blood plasma, and some of it turns into bicarbonate ions in the blood, which is part of that acid-base balance, keeping that pH of the blood at a 7.35 to 7.45. This is an explanation of everything that I just said about the non-oxygenated blood from the right ventricle through the pulmonary artery, goes into each of your lungs, branches in all the way down to the alveoli. Oxygen and carbon dioxide make their exchange, right? And that's how we are alive. With acid-base balance, there are actually two of your systems in your body work together to maintain that pH of the blood. So the lungs and the kidneys, okay, the renal system, which is going to be our next body system. Carbon dioxide reacts with water and it forms something called carbonic acid, which breaks down hydrogen and bicarbonate. Bicarbonate is the base or the buffer, it's neutral. And then hydrogen is the acid. And in order for it to stay balanced, there's got to be, certain amounts of each of those things. And your body will try to compensate. If you start to become acidotic for whatever reason, let's say you've been holding your breath too long and you have too much carbon dioxide. Carbon dioxide is an acid. Your breathing rate and depth will increase involuntarily to try to get rid of the excess carbon dioxide and regulate that acid-base balance. It's amazing. Being able to speak and sing, those kinds of things. Phonation is the ability to make sounds, and it's caused by air going through those vocal cords and making them vibrate. And you, me, all of us, we control those vibrations. They're modulated by the one, because if we want to talk loudly or we want to talk low, we are controlling how much air is passing through and how much vibration is happening to control the sound and the pitch and all those things, and how loud we are, how low we are, right? The effects of aging. I always love this part. It's my favorite part. Increased rigidity of the thorax and diaphragm. For some people, decreased numbers of alveoli and the ability for them to diffuse O2 and CO2. Decreased strength. Not everybody, some people. Aging is a very personal and unique thing. You can have two people that are 50 years old and one is in wonderful physical shape and one is not. You could have two people that are 80 years old and same. So, all of these things more apply to the individual. So to generalize about aging, I kind of, how I feel about that. I will say this: obstructive sleep apnea. Anybody that's overweight or inactive can suffer from this. It doesn't matter how old you are. So you could be young and have this problem. Is this question or is the statement true or false? Nurses should encourage frequent coughing and deep breathing exercises for their older clients. They should encourage that for all their clients, all their clients. But, and we'll talk more when we get into fundamentals about incentive spirometry and different things that we can use to encourage people to take deep breaths in and out, right? Get that air exchange moving. Okay. And remember, sitting up is always your first intervention. If someone's having difficulty breathing and they're lying flat, get them in an upright position. Just anatomically, that helps the chest cavity open so that they can get more air in and out. And I do believe that that's the last slide. All right. Hope you got all that. So we will go over this in class, but that's respiratory. And until next time, I will see you later, alligators. Bye.